Hi, everybody. My name is Michael Rintala. I'm a chiropractor who specializes in rehabilitation and sports medicine. I am also a blue belt in Brazilian Jiu Jitsu. And what I'd like to do today, right now, is share some basic concepts and principles of dynamic neuromuscular stabilization. And I'm going to do this in order to um, provide these concepts and principles uh, so that when we get to the movement preparation portion of this presentation, of this series of presentations, you have an understanding of what we're trying to do and how that will enhance your mobility, your stability, and your efficiency of movement. And also, with that, help you decrease the risk of injury, increase the chance of enhanced performance, and create durability and longevity within your grappling art, within your grappling practice. So, one thing these great athletes, great grapplers all have is the same thing that these athletes have. These are all high level professional and Olympic athletes. What I like about this video or this slide is you have different genders, different ethnicities, different body types, and different sports represented. So these high level accomplished athletes, again, have the same thing in common with these high level accomplished grappling athletes. That's this. They all have a central nervous system. And when they were first born, their central nervous system was immature, meaning once we are born, the first few weeks of life, we are kind of ruled by our lower central nervous system, so the brainstem level. And our primitive reflexes dominate. So our sucking reflex, our grasping reflex, our startle reflex, those help keep us alive during those first 4 to 6 weeks. As our central nervous system matures, and at the time that we reach 3 months of development, we attain the ability to create synergy, coordination, and timing of our deep stabilizing system and our integrated stabilizing system of the spine. If you look at the slide here, you'll see on the left at the 3 month position, we have an infant that is prone and an infant that's supine. So at the time that the infant's central nervous system is mature enough to create that synergy, coordination, and timing of that deep stabilization, then we are able to lift our heads out of a base of support, lift our legs out of the base of support. So this is the fundamental postural foundation that starts at this time. As the central nervous system continues to mature, we see 4 months, 5 months, 6 months, and beyond, we see that the infant with more central nervous system maturation, more synergy coordination and timing of that deep stabilizing system, higher, more unstable positions are able to be attained. So from 3 months to approximately 18 months, these developmental milestones are where those postural foundations are established. These are hardwired genetic uh, programs that are manifest with the healthy central nervous system maturation. So this slide also represents, you see the infant attaining these positions, but you also see the adult. Now, as adults, we have different head size, chest diameter, limb length, different mobility, pliability. But the one thing we do have in common is we have those hardwired genetic motor programs that were manifest during this time of development. So we can utilize specific positions, points of support, as you see in this slide, mimicking these developmental positions to help facilitate, wake up those hardwired patterns that we were all born with. And if we had a healthy central nervous system, a healthy development, we will be able to tap into those so that our synergy, coordination, and timing of deep stabilization is on point, so that our movement efficiency, our transfer of force and load is on point, so that again, we can practice and train in a way that's going to promote durability and longevity with what we're doing, and thus decrease the possibility of injury and enhance the possibility of increased performance. This is what I'm talking about with the deep stabilizing system. We have diaphragm, pelvic floor, the entire abdominal wall, so six-pack muscles, the oblique chain, the transverse abdominis, as well as the intersegmental musculature throughout the spine. So when we go to move, when there's any purposeful movement, the diaphragm will descend. It'll create an intra-abdominal pressure. That pressure will load that group of deep stabilizing musculature. Then that group of musculature responds. There's an eccentric load, isometric, concentric, and it manages that intra-abdominal pressure. It manages that pressure to establish a nice fixed point through the trunk and the pelvis, which then also creates a nice uprighting or unloading throughout the spine. If we're able to facilitate that fixed point, then the larger muscle groups, the oblique chains, the kinetic chains, can work off of this fixed point through the trunk and the pelvis, and thus increase more efficient transfer of force and load throughout that kinetic chain and throughout our body. So these concepts and principles were developed by Professor Pavel Kolaj from the Prague School of Rehabilitation, and he is a pediatric physiotherapist, has PhDs in pediatric and physiology. He's also a head clinician for the Czech Olympic teams, the national tennis, soccer, and hockey, ice hockey teams as well. So he has taken the concepts and principles of the developmental milestones and utilized those to develop specific assessments and specific active exercises to tap into those central postural programs, those genetically determined motor patterns that are manifest with that healthy central nervous system maturation. So here we have examples of infant in a 12-month developmental position, the deep squat. We have the Olympic athlete with the weight in the same position with the same synergy, just weight, shoes, different limb length, different thoracic cage diameter, different head size. Below, we have the grappling athlete, in this case, Marcelo Garcia, who is performing a sweep. He has that same synergy, coordination, and timing that the infant in the middle in that 6-month developmental position has. At 6 months, there's the optimal amount of, or the optimal ability to facilitate ideal stabilization. And at that point, you will see the infant start to turn all the way onto their belly. So this is where you see optimal efficiency of the turning sequence. And again, with Marcelo, we see optimal positioning, optimal timing, and optimal efficiency in that sweep, which is part of that turning sequence. So one of the main things that we address with DNS is the function of the diaphragm. The main things that we are going to talk about and then work on with the specific movement preparation is the respiratory function and the stabilizing function of the diaphragm. When we take a breath, again, that diaphragm will drop and descend. We should see this nice spreading of the lower ribs with each breath. When we're able to do that, we get full expansion of the lungs. And then after the breath in, then we exhale. There's a recoil of the diaphragm and the air comes out. The same thing, the same motion will happen with the stabilizing function and even without breathing. So if I have to load, if I have to do a scissor sweep or come up and do an arm bar, then my deep stabilizing, integrated stabilizing system, that diaphragm is going to descend, create that intra-abdominal pressure, load the pelvic floor, load the entire abdominal wall. And then with that fixed point, I'll be able to perform that technique with that optimal efficiency of transfer of force and load. The other thing that happens when we have that ideal fixed point is we have something called functional joint centration. Professor Kolage described this as being able to maintain the optimal position of the joint throughout a dynamic range of motion. So it could, in this case, if you look at Marcelo Garcia, when he's doing the turning sequence on his left side, those are two limbs are in a support function. So as he's turning, as he's able to maintain that deep stabilization, he's going to maintain the optimal positioning of the joint within that full range of motion and perform the technique or the move that he is going for. So this allows this centration, this joint centration, which is due again to that optimal stabilizing function through the trunk and the pelvis. This allows for maximum muscle pull and protection of passive structures, so the ligaments, the joint capsules, and the joints themselves. If we have synergy of agonist-antagonist throughout the kinetic chain, then again, we are going to provide optimal transfer of force and load through that chain and minimize the overload that can take place through the transitional areas of the spine and specific joint structures throughout that kinetic chain. So this video is an example of that dynamic stability. We'll see up above the infant as the infant is going in through the turning sequence. And then if we look at the video below, we'll see very similar positioning and stabilization, uprighting throughout the spine, lining up the diaphragms as we go through the sweep. So you'll see deciding what to do. The infant is, in this case, reaching for the toy. Down below, Marcelo is setting up the sweep and picking the side that he wants to go to. And then as that infant's turning, see how we have the alignment of the pelvic floor, thoracic diaphragm, and even the orofascial diaphragm as we go through that turning sequence. And then the bottom, watch as Marcelo completes the turn as well, all the way onto his belly. So here up above, we have the infant turning. Now the infant, as it develops, that turning efficiency becomes more and more natural. Just like we practice moves over and over, the infant is practicing constantly, thousands of trials and errors of going through that turning sequence. And as the central nervous system matures, so does the synergy, coordination, and timing of the support function of the lower limbs and the stepping forward function of the upper limbs, due to the increased efficiency of that stability through the trunk and the pelvis, the uprighting throughout the spine, and the ability to utilize the full efficient transfer of force and load throughout the kinetic chain. And we watch again the turn, Marcelo setting up the sweep. And the beautiful positioning, the joint centration, the deep stabilization. So here we have nice joint centration, nice stability through the shoulder girdle, through the hip girdle, nice synergy, coordination, timing, management of that intra-abdominal pressure so that he can perform that beautiful sweep. Okay, so our postural foundations that were developed those first approximately 2 years, a little bit more of life, not 2 years, sorry, 18 months of after birth, allow the anticipatory activity of our brain to perform purposeful, efficient movement. So we see this in infancy during the developmental stages where we have the central nervous system maturing. Initially, it's the brainstem level of maturation. Primitive reflexes dominate. 3 to 18 months, we have the subcortical region of central nervous system maturation. That's where the postural foundations are established. 2 to 6 years and beyond, we have cortical functions, so higher functions where we develop fine motor skills, and we are able to facilitate motor learning. And we see those developmental milestones throughout all human movement and throughout all different sports. So here, the tennis player, the combination of mobility, stability, the pole vaulter, we see a beautiful synergy and stabilization through the trunk and pelvis to transfer the force and load from the pole through the arms, through the trunk and pelvis to the legs to propel her up and over the bar. And then again, we just saw Marcelo with the sweep. Again, the same synergy, coordination, timing that we see with those developmental milestones, we see throughout life. And we have the ability to tap into these hardwired motor programs that have been there if we had a healthy central nervous system maturation as infants. So what we're going to do now is basically go through a specific flow sequence, utilizing some of those developmental positions, talking about the concepts and principles as we do it. And this will help prepare us for the sports that we love to do and that we want to keep doing. Thank you for your time, and I will see you on the next video. Thank you.